CAQH reattestation is not an HR task. A lapsed attestation freezes payer credentialing before a single claim goes out. For behavioral health organizations, CAQH quality determines whether payer enrollment begins cleanly or turns into exception work. We will cover what CAQH controls, where behavioral health teams get delayed, and how to connect credentialing status to billing before claims go out. Walk through the profile, the reattestation cycle, the most common failure modes, and how your RCM platform should support the whole process. CAQH ProView is the centralized credentialing database used by more than 1,000 health plans and accessed by over 1.4 million providers. Instead of sending the same packet to 15 payers, a provider builds one profile and authorizes each payer to pull it. The profile is free for individual providers and a practical requirement before commercial payer credentialing can begin. When attestation lapses, the profile goes inactive. Payers cannot access an inactive profile. Credentialing stops, and some payers terminate the provider. A new clinician who cannot bill for 90 days because of an incomplete CAQH submission means 90 days of unreimbursed clinical time. Some Medicaid programs classify pre-credentialing billing as potential fraud, triggering recoupment demands. A generic EHR tracks licenses in a folder. Behave Health connects credentialing status directly to your payer roster and claim submission controls. The RCM module maintains a payer-by-payer roster that blocks claim creation for provider-payer combinations not yet active. Credentialing-linked denials surface as a distinct category in the RCM dashboard, so your team catches them the day they occur. Most credentialing delays in behavioral health trace back to 5 preventable failure modes. Each one is fixable before it becomes a payer defect. Failure Mode 1, Lapsed Attestation. CAQH attestation must be renewed every 90 days. Miss the deadline and the profile goes inactive, invisible to every payer. For facilities with multiple clinicians, stagger attestation dates so they do not all come due simultaneously. Failure Mode 2, an incomplete profile. Payers will not begin credentialing review until the CAQH profile is 100% complete. Commonly missed fields: unexplained work history gaps over 30 days, malpractice history, and incomplete practice location details. Failure Mode 3, a taxonomy code mismatch. If the taxonomy in CAQH does not match your NPPES record, payers see a mismatch that causes claim rejections and authorization denials. Failure Mode 4, payers not authorized to access the profile. A complete CAQH profile does not automatically share data with every payer. Each target payer must be explicitly authorized. Failure Mode 5, stale or inactive practice locations. Inactive location data is one of the most common reasons enrollment packages return with defects, especially after moves or new sites. Even a clean CAQH profile means waiting on payer review. Build these windows into your calendar. Most commercial payers run 60 to 120 days from the day they receive a complete application. United Healthcare and Optum run 60 to 90 days. Anthem and Carelon average 90 to 120 days. New state treatment centers should plan 120 days for commercial payers and 180 days for full Medicaid participation. Stop losing revenue to credentialing gaps. See how Behave Health connects credentialing status to your billing controls. Book a 20-minute demo at behavehealth.com. Book a demo at behavehealth.com.